Hi, I'm Dr. McClintock at the Orthopedic Specialty Center of Northern California. I'm an orthopedic surgeon who specializes in shoulder and elbow surgery. And I wanted to talk to you a little bit today about one of the common questions that I get from patients, specifically elderly patients and those that are undergoing surgery when they're a little bit older in life. One of those questions is surgery safe for me? I wanted to give you a little bit of data regarding surgery in the United States and how it might pertain to you. Approximately 50% or more of the procedures that are performed in the United States every year are performed on patients over the age of 65. So when we're talking about surgery and being safe for elderly patients, it's important to take into account multiple factors and understand that a lot of patients having surgery are over 65 years old. We look at multiple things like other medical conditions, things like diabetes, heart disease, history of a stroke, and we use that information to kind of make a better decision, and as a surgeon really explain to you the risks and the benefits associated with the surgical procedure given your current situation. When we talk about whether or not someone is healthy enough to undergo surgery, we're really kind of talking about this idea of being frail. In medicine, frailty is a term that's used to describe people who are weak or tired, malnourished, struggling, have other medical problems, and their body just isn't able to tolerate the stress of a surgical procedure or general anesthesia. So the first step in this process is to get the facts. Understand from your medical provider, your surgeon, your primary care physician, those things that are going to be pertinent or important to you as you decide whether or not surgery is something that you want to pursue. When we talk about those facts, you want to know what the risks of the procedure are. Are there complications associated with that procedure? What's the recovery time? Do you have any medical conditions that would put you at an increased risk of having a negative or bad outcome or complication? How are you going to care for yourself after the surgery? The other thing to think about is, what are my treatment options if I choose not to undergo surgery? If I choose to just live with this condition, how will that impact my life? And then really take all those things into consideration and weigh those risks and benefits so that you can make an informed decision. One of the first things that can be helpful for patients who are a little older when they're undergoing surgery is this idea of prehabilitation. So oftentimes we talk about rehabilitation, which takes place after surgery, to get the involved shoulder, hip, knee, whatever it is, back to good functioning status after you've had a surgery. But this idea of prehabilitation takes place before surgery. When we're talking about this, it's important to understand that your body as a whole is a really complex system, and that other things that you can do to help ensure that you would have a good outcome can be undertaken prior to the procedure to minimize your risk of having a complication or something along those lines after the surgery. Staying active, being fit, working on core strengthening exercises, working on discontinuing medications that can predispose you to a negative outcome or side effect associated with anesthesia, making sure that you're eating a high protein diet. Protein is essential for our healing ability, and you can really help your own recovery by making sure that your protein levels and your nutrition is up to par before you undergo the surgery. And staying hydrated, making sure that you have enough fluids on board so that you don't have any complications associated with dehydration post-operatively. One of the really important things is also surveying the situation that you have at home. What does your living arrangement look like? Who's there to help you? Do you have family members close, a spouse, someone else, a neighbor who can help take care of you? Help you organize your medications, help you get to and from physical therapy. In our office, we're trying hard to work on helping to bring some of those services into your home. The thing that's really nice about that is it allows us to survey your home environment beforehand, make specific recommendations regarding potential hazards that may be there, and how you can kind of set everything up before you have surgery, so that once you return home from surgery, you don't have to worry about anything. Everything's already taken care of. And then those therapists will be in the home regularly to check on you, to help you work through the rehabilitation process, and have really good direct feedback with us and our office staff to ensure that we stay on top of any potential complications that may arise, and make sure that you're progressing and hitting those milestones that we want you to hit during that recovery window. Some of the things that you can do before surgery would be installing a shower chair or a handrail in the bathroom or shower, removing anything that might be a tripping hazard, like a rug or a small footstool or something that you just might lose visual sight of as you're trying to navigate after you had surgery. Putting things that you're going to need on a regular basis in easy to access positions, coffee cup, a water glass, the TV remote, a telephone, things that you might not necessarily think of, but that you would use on a regular basis, a charger for your phone, those kinds of things, so that if you needed that item, it's easy to get to. It doesn't cause any difficulty trying to track it down, or put you at a potential risk of, rummaging around trying to navigate or find something, and then you fall or find yourself in a bad situation. Another thing that's really important is kind of planning how you're going to take care of yourself afterwards, for simple things such as eating, preparing meals, and grocery shopping. So one option is to go ahead and prepare those meals beforehand for a certain set amount of time, freezing those meals. You could sign up for a food delivery service, Meals on Wheels, DoorDash, whatever it may be, a neighbor or a friend who's offered to come and help. Anything that you can do to minimize the things that you have to do on your own, and to make your life a little more convenient. And finally, a nutritional program is going to be really key. We talked about protein building before surgery. You're going to want to continue that after surgery to make sure that you're maintaining your nutritional status. You're staying hydrated. You're getting all of the essential proteins, vitamins, and minerals that your body needs for healing. Healing is a very complex process within your body, and it has all those moving parts available, but you need to feed it, and you need to make sure that it's working efficiently. It's also important to identify caregivers. We've talked a little bit about this, but who's going to be that person or those people who are going to help take care of you in this post-operative period? It's a family member, a neighbor, a spouse. They're going to be not just taking care of you and helping you with meals and showers and hygiene activities, but also offering you encouragement. Rehab can be challenging sometimes. It can be painful. There can be ups and downs, and it's always good to have somebody there who's a support system, somebody who can give you encouragement, and somebody who can kind of cheer you on through that process and celebrate those little victories that you're going to have as you make that progression through your rehab process. Overall, I think when you look at this situation, most patients who are identified to themselves as being too old or too elderly for surgery are actually not. There's a lot of things that we can do by working with a primary care physician to optimize your medical status, make sure that your chronic medical conditions are under control, that you're in the best physical and nutritional shape as possible leading up to the surgery, and then having a really well-balanced support system for you at home to help you have a successful recovery after surgery. So family members and friends are a really critical part of the recovery process and your support system after surgery. It's not uncommon that I will encourage patients to bring their family members, bring their friends, bring those people who are going to be helping them during that pre and post-operative window to come into the office for that visit, so that we can talk together and we can listen to one another's concerns and standpoints, and then really work as a collaborative team to build a plan that's going to be the most beneficial for the patient involved. And I think that when we do that and we bring in the primary care physician and the therapists, and we have this really robust network of support, that patients and family members both feel a lot better. They're more at ease, and they feel confident that the plan that we put together for this individual person is going to lead to a good outcome and allow them to, improve their function, their lifestyle, and get rid of the pain that's been troubling them. So that's also a really critical part of this whole process, is to involve those family members and bring them into the office so I can get to meet them, they can get to meet me, and we can work together in this process.